All right. Hi, everyone. We are live. Thank you so much, Kristina, for joining me. Let's give it just 2 seconds to see if we can get any people to come on, and then we'll get started.
Sounds good. Thanks for having me.
Yes, pleasure. My pleasure. All right, let's begin. So, hi everyone, I'm Sandra Shpilberg. I'm the founder and CEO of Adnexi. Adnexi is a technology platform to help biopharmaceutical companies learn about their marketplaces. So we very quickly get information about patient advocacy groups and key opinion leaders and other companies in the ecosystem, and we do that through the use of technology. And this particular live stream is all focused on patient advocacy and the role that it plays in drug development, as well as what's going on right now during COVID-19. And so for this, I invited Kristina Wolfe, who is a patient advocate and a biopharmaceutical professional herself. And so Kristina, I'm so glad to have you on to talk about this topic.
Yeah, Sandra, thank you for having me. Hey, everybody that's joining. I don't know if anybody's actually on here yet, but I'm excited to be here.
Great,
so.
Exactly. And we'll hope some people join, and if they don't, then they'll have the video to look at us later, and they can always send us questions. So let's start at the beginning, Kristina. So why don't you tell me a little bit about your journey into patient advocacy?
Sure, it's a great question. I think, so I've lived with type 1 diabetes for over 26 years now. I've had it for a really long time. And I think a lot of people these days kind of get diagnosed and almost automatically become advocates for themselves through that diagnosis process. But because I was so young, when I was diagnosed, I was 6 years old. It took me a while to kind of not only learn myself, who I was, what I wanted to be when I grew up, but also learn how to take care of myself and to allow for others to help me take care of myself. I think I realized on the diagnosis bed that I wanted to be a doctor. And I wanted to help cure type 1 diabetes. That was the big, bold claim I made when I was 6 years old. I haven't quite done that yet, but I did pursue a career in clinical research, as you know, and I've been able to use that as kind of a platform for my advocacy. So when I first stepped into somewhat of a project management role in the clinical research space, I was learning about a lot of different protocols and a lot of different protocols that I could potentially qualify to enroll myself into to participate in a clinical trial. And that right there, it was my curiosity that stemmed it. That's when I stepped into the advocacy role. I learned that these protocols weren't very friendly for a patient, especially not for me at that point in my life. And something needed to be done to make it easier for patients to actually contribute to research that we really do want to be a part of.
Absolutely. Yes. What a journey. And I love where you ended up, which is that you're now helping other patients like you, both from the patient advocacy side and also from the research side, which is wonderful. So how would you define patient advocacy? What is patient advocacy?
So I think the world can see patient advocacy in a lot of different views. We've got advocates across the board. So like if I were to ask you, Sandra, who you advocate for, I'm sure some of the first people you advocate for are your children. Those are the first people you say. So we advocate for each other as patients, but I think a lot of times the things that go unseen at least in the biopharmaceutical arena, is what we have to do as patients kind of behind the scenes in terms of advocating for ourselves. So the phone calls to schedule doctor's appointments, lab draws, x-rays, MRIs, whatever it is that we need to schedule to make sure that we're taking care of ourselves and managing our diseases. that takes multiple phone calls to do, multiple emails through patient portals, etc. I think beyond that, it can be advocating with the insurance companies on the claims that you're filing and the claims that they're saying they're not going to cover. Situations like that, a lot of that takes time and energy that I don't think, and I'm saying a normal person, but someone with a non-chronic disease or a non-rare disease doesn't have to do much of. So I think that's the harder part of patient advocacy, I would say. Patient advocacy from a biopharmaceutical standpoint, I think that's been a huge shift in our industry. I think it's a great shift that we're making. We're starting to have chief patient officers and, chief patient advocate people within these organizations. I think it's a beautiful thing. I think those people are a lot of those people, the famous ones that I'm thinking of right now, those people are influencers themselves. They are wonderful managers of people. They get people motivated to make change and to push forward. And so I think they're able to engage with patients on their own on a very human level, but then they're also able to pull those insights in to the research and design of their clinical trials and even into their commercialization space.
Exactly. Yes. And I think that is one of the things that we're noticing right now with Adnexi and our platform. As we go into different rare diseases, non-rare diseases, we're seeing that patient advocacy is changing. It's not just that national organization that has an executive director and a budget and a fundraising plan, but it is also that influencer that is on Instagram, right? And is running an account with 5,000 followers and is all devoted to covering her disease and puts, daily or weekly content on that disease. So I'd love to hear a little bit more about what you think of that, those types of influencers that are on Instagram, on Twitter, and they are really devoting a lot of their voice to talking about the disease that they have.
Yeah, so I'd say there are a lot of different thoughts I have on the influencers. I would consider myself maybe one of them. What I can share with the audience here and with you, Sandra, because I don't think we've been able to connect with on this yet, but COVID-19, I think the environment of where we're at in COVID-19 has shifted the industry from the nonprofit side, from the influencer side, from the biopharmaceutical side on how much we're able to do in a model that was existent in 2019. It's not the same anymore. And so people are more virtual. They're engaging a lot more on these Zoom calls, on these live streams, on different social media networks and things. And so the reliance of these influencers has been huge, I think, to share lessons learned through the COVID-19 arena as well. I think that's been one of the biggest shifts I've seen is we're not sharing so much about kind of a day in the life of me or, me as a patient. It's more of what has shifted in my life and how am I addressing it to make sure I'm managing my disease appropriately. Some things like that have been huge to help the patient communities themselves. One note, though, is being a quote unquote influencer is exhausting. And so I think the title, the little picture thing that you created with the Adnexi logo, it titled me as a patient advocate. And while I claim to be that every day, because I am, it's exhausting to have to be that person day in, day out, because I feel like sometimes I have people that are relying on me to get them answers or to help them get what they need. What I'm hearing I just wanted to make that note. It has been increasingly exhausting during COVID-19.
Yeah. And so what I'm hearing you say is that it is exhausting because to some extent, like your identity is defined by that title, right? And now it comes with sort of certain expectations that what you are talking about, what you're educating other fellow patients on, somehow reflects you.
Yes, absolutely. And, we could go on for days about that. I think I have learned that it's okay to step back and actually take that hat off a little bit and invest in other areas of my identity that actually bring joy to me a little bit more during this time. So.
I'm hearing you. So let's shift gears a little bit and talk to me about the role of patient advocacy in drug development. How can patient advocacy and patient advocates help the development of a drug?
I think the first thing, drugs have to go through these clinical trials. And increasingly, we've seen over the past handful of years that we've got patient steering committees or patient advisory boards helping biopharmaceutical companies design their protocols, design their programs to make sure that it's inclusive of all of the different demographics that they're trying to target.
Yes.
This drug. I think, contributing to those conversations is huge. But not everybody, so I mentioned it's exhausting. So not everybody has the energy or the bandwidth to do that. And if you are a patient, if you are interested in contributing to research, you can also share your health data. So the Clinical Trials Transformation Initiative is working with a ton of biopharmaceutical companies to engage with patients on a level to collect that information. It is de-identified, but it can help drug companies transform their initiatives. And I think that's one of the smallest things you can do. That's I guess one example, but I could go on for a long time.
That's great. That's great. And let's see. So a couple more questions just to wrap up. So first one is heart is a big part of this patient advocacy equation. And I think you mentioned that you're bringing your whole identity into it as well. So how do you bring your heart into this patient advocacy? How does this connect to your heart?
Oh, that's a loaded question. So I think it's being, for me, it really was, I think, learning, well, initially it was my heart. I wanted to make a difference for other patients like me. So I went to bat and said, we've got to start changing these protocols. We've got to start making sure that these are patient friendly, et cetera, et cetera. I think at this day and age, I've shifted a little bit more because I'm not so focused on that. I think I'm trying to, bring my whole life into it. So I've got a ton of interests. I like surfing, fishing, CrossFitting, competing in CrossFit competitions and things like that. And so my personal page, my handle for Twitter and Instagram and stuff like that, instead of always talking about my disease, instead of always talking about the mental health comorbidities that come with my disease now, sharing just a little bit more of how, what it's like to be just a normal person, to be perceived as normal, and to actually live with a chronic disease. So I think that's another struggle that a lot of patients as advocates have, is that we're perceived as normal. And so when we have a bad day, there may be a higher expectation of us than what we're really able to meet.
Yeah, I think that's really interesting what you just said there, because it's sort of like there's this balance, right, between you wearing the label of I am a patient advocate and I have this condition, right, and taking that off completely and saying I am a human being, right, and I am doing CrossFit and I'm doing, going surfing and doing all the things that you're doing as a human being, right? Not defined by the disease. So I think that that's really interesting. I feel like that's like a really interesting balance there to play in terms of the identity that you wear. And it has to be much more intense for somebody who is a patient advocate and is putting herself out there, right? Saying, I am going to be speaking about this condition. I'm going to be posting about this condition. So I really appreciate that balance. Absolutely. Is there anything else that you want to share with us today, Kristina, about patient advocacy, your journey, the intersection of that and drug development?
Yeah, I mean, I think if for those that are on here that are interested in patient advocacy, whether that be as a patient or as a biopharmaceutical executive or employee, you know, advocates are needed everywhere. And I would encourage you to reach out definitely to Sandra, to myself, if you'd like. Happy to connect you to resources that will fit your life well. And I've been doing these reflections every 3 months to see kind of what's bringing me joy every 3 months. And that has really helped me develop this whole identity thing a little bit better. And so as you get more and more into your patient advocacy, if you are a patient, just be mindful of how it's making you feel, of your exhaustion and stress levels. And if it's taking away from your joy, then maybe we should back it down a notch. That's what I've done. So
I love that 3-month reflection. So in your last 3-month reflection, do you want to share where does patient advocacy fit in regards to the other components in your life?
Yeah, so I think the last time I reflected was June. So I'm coming up on the next time I'll do it. I had decided the time before that, so February, I guess, March, that I would kind of step back into the shadows a little bit more and give myself some grace and a break. And it was because the term that I used over and over again in those few reflections, especially in the reflection at the end of last year, was exhaustion. And so I slowly tried to peel back some layers to that exhaustion and where it was resulting from. And a lot of it had to do with the stress that I was carrying from feeling like I was responsible for other people.
Yeah.
So,
yeah. Yes, I think you're getting to something important here, that if for those that are taking on this role of patient advocacy, there has to be like important internal work that has to be done, right? To see where you end and where the other people begin, right? To sort of set that boundary of like, you know, this is your life, this is your experience, and it may or may not be the experience that other people have. But I hear you that putting yourself out there and being a voice, you know, has definitely sort of like that identity consequence to it. Yeah, I hear you. Well, Kristina, this was awesome. Thank you so much for sharing your thoughts and sharing your journey as a patient advocate and also a professional in the biopharmaceutical industry. Really enjoyed our discussion. We've had a couple of people saying here, hi ladies, great to see you both. Really appreciate participating. I am going to do 2 things after this live stream. One, this will be up on the Adnexi website if anybody would like to review the video. And then 2, I am going to put a comment with a form to fill in case there's anyone out there who would like to be on this live and share their experience with patient advocacy. And especially I'm interested in that intersection between advocating, educating patients, and helping drug development, helping new treatments get developed faster and more efficiently. All right. Thank you. Thanks, Kristina. That was awesome. Bye. Bye.